Hi everybody, Dr. Stu Katzen here. Today is the first of a series of videos we're putting together to understanding different health issues and problems we may come across in the office or as athletes. The first one I'm going to be discussing today is low back pain. Probably the most common thing I see in the chiropractic office. But a lot of people may take for granted or don't have a full understanding of what can happen with the low back. There's a lot of things, there's a lot of structures, a lot of anatomy. So I'm going to take a moment to explain what may be happening or may not be happening to help you better understand what could be happening with low back issues. Now, there's things we have to look at, especially as a doctor of chiropractic. There's different sources of pain and dysfunction. You can have a muscle problem. You can have a joint problem. You can have soft tissue injury. You can have overuse injury. You can have acute trauma injury. And all these things could be flexibility, mobility, all these things can tie into different sources of problems. So the first thing I want to go for everyone to understand their back is the anatomy of the back and the anatomy of the spine per se. Now there's 26 bones in your spine. Each one is freely movable. And between each pair of bones called a disc. The disc has two purposes. One is for shock absorption, and the other one to create space between the bones so the nerve can exit. That's how the brain communicates to the rest of the body. So balance, coordination, agility, all that is neuromuscularly involved. So there's a misalignment of your joint, it could potentially irritate that nerve. That could be a source of pain. That nerve can also irritate the muscle, so that can cause muscular dysfunction. Also, if the spine is not properly aligned, the joint itself has pain receptors, so if it's not moving properly or aligned properly, that can cause irritation and discomfort. Now, the disc itself can be a source of pain for people. The anatomy of a disc is such, we like to use the analogy of a jelly donut. There's a gelatinous material in the middle, and there's cartilage on the outside. Now, if there's any disarrangement or the nuclear material, the jelly material, bulges to the outside, that can be a source of pain and discomfort. If the disc itself bulges, it can bulge on a nerve. The outer 2/3 of the disc itself has pain receptors, so that can be a source of pain. So already just the physical anatomy, we have multiple sources of pain and discomfort. Now, the athletes we work with, there could be some overuse. We do a lot of heavy weightlifting, so that can strain a muscle. There could be a sprain versus strain, and as a doctor, we can diagnose the difference. And if there's an overuse injury of the muscle or a strained muscle or an injured muscle, there's some therapies we can do to help reduce that kind of tension. And if there's misalignment issues as a chiropractor, in the next video we'll be talking about the different types of treatment for these injuries. Today we want to focus on just the understanding of what's going on here. So if there's any misalignment, soft tissue injury, misalignment, inflammation, irritation, overuse injury, these could all be sources of pain for the low back. We also can't overlook the muscular components. There are other insertions and origins of muscles. One of the common things I see with working with CrossFit athletes and runners is the psoas muscle, which is the #1 hip flexor of the spine. One of the interesting anatomy of the psoas muscle is that it's the only muscle in the body that actually inserts to the discs. So to review what I said earlier, the outer 2/3 are the pain fibers. So if the muscle pulls on that due to contracted psoas muscle or contracted hip flexor, that can mirror back pain. And if by rectifying that, often alleviates some of the problems we have there. Also have the nerves that come off the back. People have talked about a sciatic nerve problem, which is the largest nerve in the body, comes off the low back. Can be irritated down the back of the leg, can be irritated at the back, can also be irritated with contracted piriformis muscle, which is in the glute muscles. So these are all the things you'd want to look at when someone has complaining of low back pain. So again, we want to rule out if it's muscular. You want to rule out if it's a joint problem. You want to rule out if there's any soft tissue irritation. They can also be just inflammation, swelling, which we treat it in one way. It could be lack of mobility, lack of flexibility. All these components want to be looked at and addressed in diagnosing the problem of low back pain. And then on the next two videos, we're going to be discussing the treatment, one in the office, and another video on how you can try to help take care of your own problems and help manage your own health. Because at the end of the day, your health is your responsibility. So feel free to, if you have any questions, never hesitate to ask the office. If you see me over at the CrossFit gym or at the office, do not hesitate to ask for any questions. And I look forward to working together, answering any questions, and I hope you found this video informative. Thank you.